Dr. Vira, welcome back. So good to see you.
Good to see you as well. Thanks for having us back.
Absolutely. And I know today we're going to educate people on some of the common things that you see, common problems in your office. We're going to talk about something we hear about, even some famous movie stars. We see ads complaining about dry eyes. Why do people get dry eyes?
So dry eyes is one of the most common things we see in the clinic itself. More and more patients are coming in as the weather changes, patients come in with irritating symptoms itself, or even just because they're working on the computers and having symptoms from that itself. And these symptoms can vary from eye irritation to a gritty, sandy sensation in the eye to just intermittent blurred vision or even just fatigue at the end of the day. And those symptoms can be mild, where they're coming and going, or it can be even quite debilitating and severe for patients itself. And so we tell patients, you know, if you're having these symptoms, definitely seek care with an eye care professional to figure out what's going on with your eyes.
Absolutely. And what can be done about it? Drops, surgery, or?
So typically we will tell patients that this is, a condition that can be easily treated with lubricating eye drops called artificial tears. And these can be bought at any drugstore itself, and they vary in brands and things like that. And most of them work very well, and they can vary in the consistency from a thin, watery to a gel form, and they can be used to help patients or help them with their symptoms itself. Sometimes patients will ask us questions like, are there drops that get the red out too? I usually advise patients not to use those drops, just stick to the lubricating drops called artificial tears.
Okay, so it's not so extreme that you need to do any kind of surgery. Drops are usually the thing that can fix them and get them feeling better.
Yeah, absolutely. There are other medicated prescription drops that can be used, but for most patients, the over-the-counter artificial tears work well.
Okay, and then another common problem that you see as we get older, unfortunately, cataracts. So let's talk about that. What actually is a cataract?
So a cataract is just the natural clouding of the lens itself, and it starts usually in your mid-50s and gets worse as you get older. And when you're young, the lens is very clear, but as you get older, the proteins degenerate, the lens turns cloudy, almost into this yellowish, brownish color that doesn't transmit light very well. And symptoms can vary from not being able to see things clearly while they're reading and having difficulties with focusing. Just images are not very sharp and out of focus itself, and colors can fade too. And patients may describe having difficulty driving at night as well, where they're getting glare from and halos from oncoming headlights.
And is this something that can be treated easily, or in many cases surgery is kind of the best?
Yeah, in early cases where the cataract is not very dense, patients can get just updated glasses, but as they progress, which it does in most patients, that's when surgery is indicated, especially when they're having difficulty with driving and reading. And cataract surgery is a very safe and sophisticated procedure. It only takes about 10 minutes to perform. And it's done under mild sedation itself. And over 3 million patients get this surgery done in the U.S. alone. And outcomes are very good, with over 98% of patients seeing better after surgery.
Yeah, and I've met some of your patients, and they say how it has really changed their lives. And I probably wish that in many cases that they'd done it sooner.
Yeah, that's absolutely the case, is that patients sometimes will wait and wait, thinking they don't want to go through the surgery because they're worried and apprehensive. But it's a very safe procedure, and like I said, it only takes about 10 minutes or so to do.
And how are cataracts different from glaucoma?
So glaucoma is a different condition in the sense that with cataracts, we worry about it being, vision loss that's reversible, versus with glaucoma, it's irreversible and permanent. It's actually one of the leading causes of blindness in our country, and it can occur with age as well. And patients over the age of 60 are usually the ones that we're worried about. And what it is, it's a damage to your optic nerve from pressure that may build up in your eye itself, and it can cause damage to your nerve fibers, which is in your optic nerve, which is the cable that connects your eye to your brain itself. And over here you can see that the way glaucoma affects your vision is on the picture to your right, that affects your peripheral vision. And many patients, the symptoms are non-existent when the case is very mild. And so if you are someone who has a family history of glaucoma.
I am, unfortunately, my grandmother and my mom.
And so you should definitely have an eye exam in that case. And or anybody who has been told that you have higher pressures in your eye, you need to be screened for glaucoma itself.
Okay, such good information. And then finally, macular degeneration. What is that?
So macular degeneration is another cause of blindness in our country itself, different from cataracts and different from glaucoma as well. It also occurs in individuals that are over the age of 60, and it's also known as age-related macular degeneration. And the way it works is that it causes damage and alteration of the retinal structures of your eye. And here you can see the way it affects your vision is it can cause this blurred vision or distortion in your central vision, and you're not able to see things clearly in the center part of your vision, as opposed to with glaucoma, it's your peripheral vision.
Right, it is like spots or and completely impeding your vision.
Yeah, and some people initially may describe that they're seeing like wavy lines or just not seeing things very clearly, where things are bending or breaking centrally in their vision, and it can progress as well.
And what can you do for that?
And so treatment for macular degeneration in the beginning involves the use of specifically formulated eye vitamins. It contains vitamin C, vitamin E, copper and zinc, as well as lutein and zeaxanthin. And all these things have been shown to prevent vision loss. In some cases, when it's severe, in what's called wet macular degeneration, we may even recommend doing injections into the eye.
Wow, again, such great. I always love having you on the show because these are things that people are dealing with most often as we're getting older. So valuable information that we need to know. We can get the help at Milan Eye Center. And you also have a way to help those of us who work a 9 to 5. You have a way to get us what we need on the weekends, correct?
Sure, sure. And so we just started offering Saturday morning clinics to our patients. So anybody who's working doesn't have time during the week to see us, we offer this to patients, especially for cataract consultation and also for LASIK evaluation as well.
Wonderful. Good news for anybody who might be suffering out there. And then tell us about all your locations. And I hear congratulations are order. I see Alpharetta is coming soon, so that's incredible. Good job.
Thank you, thank you. We have 5 locations currently in Johns Creek, Cumming, Beaufort, East Cobb, and Canton. And we're excited to open our Alpharetta location in December.
Good. And if anybody wants any more information, of course, you can head to the website. But in the meantime, they have a great special for Atlanta and Company viewers.
Absolutely. We're offering $500 off of LASIK for anybody who calls us and makes an appointment in the next 24 hours.
Fantastic. Thank you so much, Doctor. Always love seeing you. Once again, take advantage of that special, or if you have any of those problems we talked about today, just get them checked out. If you want to learn more, simply head to milaneyecenter.com. That's milaneyecenter.com, or call the number on your screen, 470-326-0331. Thank you, Doctor.
Thank you.